I'm Howard Frumkin, a physician, epidemiologist, and a professor at the University of Washington School of Public Health. Public health is all about achieving the best health for the most people. And that's why I'm so glad to speak with you today, because parks, green space, and outdoor recreation are very important tools in the toolbox of public health. So much so that we're on the same team. You are public health professionals. Now I'm going to show you some of the evidence to support this claim, and then talk about what it means for the way we manage our parks. But before that, let's ground our conversation in a review of some of the health problems we face as a nation. The news is not all good, unfortunately. This is a picture of the distribution of obesity on the upper map and diabetes on the lower map across the country 2 decades ago. Fast forward 10 years and you can see that the number of states that are getting redder and redder is growing. Obesity and diabetes are spreading fast across the country. And a decade later still, things look even worse. There's a rapidly galloping epidemic of obesity, diabetes, and some of the other diseases that flow from those problems. This is an epidemic and it's not going in the right direction. This is a graph of the prevalence of asthma in the United States, and as you can see, it's almost reached 10%. When you consider that a decade ago it was half the level that it is now, you can see that things are not going in the right direction. So something about the way we're living our lives, our environments, our lifestyles, isn't going well for our health. Now, depression and anxiety are 2 of the major mental health problems, and those are highly prevalent in our society too. More than 15 million American adults suffer from some form of major depressive disorder, and 40 million adults suffer from anxiety disorders. Probably everybody listening to this talk has either experienced one of these or has a family member or friend who has experienced one of these. And moreover, these problems are not equally distributed across our society. These are maps from Public Health Seattle-King County showing that some parts of our county have much worse risk factors for bad health and much worse health compared to others. You can be in 2 neighborhoods just a bicycle ride apart and they can have a difference in life expectancy greater than 10 years. So equity issues are at the heart of our concerns about public health. And if we have strategies to advance public health, it's very important that we target those to those who are most vulnerable. Now, that was a grim recitation of some of the health problems we face. But the good news is there are some solutions at hand, and some of the most important of those solutions lie with you as parks and recreation professionals. A lot of us think intuitively that being outside, being in beautiful natural green spaces is good for health. It's true for adults, and it's equally true for children, not only as a component of a good life, but as a part of normal, healthy, wholesome development. Contact with nature and green space reduces stress, it improves sleep, it reduces anxiety and depression, and is associated with greater happiness. In addition, green spaces are associated with reduced aggression, more pro-social or friendly connected behavior among people, both children and adults, with reduced symptoms of ADHD among children, and with greater physical activity. Green space is associated with lower blood pressure, smoother recovery from surgery, a phenomenal observation, with better birth outcomes, and with improved pain control, both the acute pain of a medical procedure and the long-term endurance of chronic pain. Green neighborhoods are associated with lower obesity, with reduced diabetes, with better eyesight in children, and a mixed result when it comes to asthma. In fact, some studies show that certain kinds of trees or tree canopy in cities can actually worsen asthma, depending on the species of trees. But in many studies, we see that canopy actually improves respiratory health as well. And finally, among cancer patients, health and survival are better. This is true of the general population. General health is better. And in elders, life expectancy is longer if they have access to parks and green space. I wish we had a pill that was this beneficial for health. Now, am I just claiming this, or do we have a basis for it? Let me show you a sampling of the evidence. Here's one example, a walk in the park. This one was done in Japan. A couple of dozen young men were randomized either to walking in the park or to walking in an urban setting, and they were measured before and after the walks in terms of their physiology, their nervous system function, and in terms of their mental health. It turns out that when compared to the urban walk, the walk in the park resulted in lower heart rate, higher heart rate variability, which is a good sign. It implies better functioning of the nervous system, higher scores for comfort, for relaxation, and for vigor, and importantly, lower scores for tension, anxiety, anger, hostility, and confusion. 15 minutes walking improved both physiologic and mental health. But more of the evidence comes from natural experiments where people are sorted into different categories by some other process, just coincidental sometimes, but the investigators recognized that they can compare two groups of people and learn about the benefits of nature contact. A 1984 study where the investigator realized that there was an opportunity to compare nature view out a window with lack of nature view. This was a hospital in suburban Philadelphia, Pennsylvania. When you had your gallbladder out, you went to the post-surgical floor to recover. Half the rooms looked out on trees, indicated by the green arrow. The other half the rooms looked out at a brick wall, indicated by the red arrow. Which room you went to was a random function of where there was a room open at the time. And the investigator was able to compare 10 years of records of the tree view patients versus the brick wall view patients. What they found was that if you viewed trees out your window post-operatively, you had a shorter hospitalization, you had less need for pain medications, and you had fewer negative nursing notes. A powerful beneficial effect, inarguable results simply from viewing nature out a window. Another very important series of studies came from investigators at the University of Illinois. They studied the Robert Taylor homes, pictured here, a kind of a grim 3-mile-long stretch of public housing bounded on one side by a highway, on the other side by train tracks. 28 identical buildings, except some of the buildings had trees outside them, as indicated in this picture, and some had barren exteriors, as indicated here. Which kind of a building you went to was a random function of when your name came to the top of the housing authority list. The investigators compared the people who lived in the tree buildings with the people who lived in the barren buildings, and they found some incredible results. If you lived in a building near trees, then you were more likely to know and greet and help your neighbors. You had better social connectedness. You were less likely to be either the victim or the perpetrator of psychological aggression or of violence. And for the children, there was better attention and better school performance, although more in the girls than the boys, interestingly, and we can't explain that. The next natural experiment takes place in Philadelphia. Philadelphia has tens of thousands of vacant lots. The city has put them on a list, and they're greening those lots, removing the trash, removing graffiti, and putting in lawns, some trees, and generally a nice fence. Well, you can compare the lots that have already been greened with the ones that are not yet greened. And that's exactly what the investigators at University of Pennsylvania did. They found that in the lots that were greened, and in the blocks near those lots, there was a reduction in gun violence, a reduction in vandalism and criminal activity, a reduction in self-reported stress, and people were getting more physical activity. Simply a little patch of green was able to achieve all of those results. Most of our studies are observational studies. We don't have a comparison between this group and that group, but we simply look to see if there's an association between green neighborhoods and some positive outcome. A study in Toronto was able to look at the distribution of urban trees, identifying some neighborhoods that were more green and some neighborhoods that were less green, and look at the impacts on mental health and on cardiac and pulmonary health as well. What the investigators found was very interesting, and they expressed it in an interesting way. They took the better health outcomes and expressed them in terms of how they would equate to being younger or being wealthier, two things that are known to predict better health. When it came to general health perception, do you think you're generally healthy? Each 10 additional trees on the street were comparable to a $10,000 increase in annual income or being 7 years younger. When it came to cardiometabolic conditions, high blood pressure, diabetes, and so on, each 11 trees on the street was equivalent to being $20,000 wealthier or 1.4 years younger. So again and again, we're seeing that access to greenery, in this case tree canopy, seems to be good for health. Let's turn now to studies that specifically look at parks. Is it the case that more parks or better parks in a city are associated with better health in that city? First is a study correlating urban parks with physical activity and with obesity using two important databases here in the U.S. the Trust for Public Lands City Park Facts database and the CDC's Behavioral Risk Factor Surveillance System, a national survey of health data. When you put these two databases together, what emerges is that a greater park density in a city is associated with more physical activity among the people in that city, with less obesity, and with less chance of being overweight. And the second example comes from this study using something called the Gallup Healthways Well-Being Index. It doesn't so much look at health per se, but it looks at well-being overall. Physical well-being, community well-being, social, financial, and a sense of purpose. When you take a look at those outcomes, and when you match those against the Trust for Public Land Park score, as these investigators did, what they found was that parks are a significant predictor of overall well-being, and that goes for the density of parks, the quality of parks, parks and the accessibility of parks. Well, we know enough from the parks research literature to know what features of a park make it work well as a public health strategy. People like parks and use parks and are active in parks if the parks are accessible, they can get to them easily and safely, if the parks are clean and well maintained, if the parks have amenities such as bathrooms and good lighting, if the programming is good, and that's a very important feature. It isn't just the park itself, but it's what people can do and are assisted in doing once they get to the park, and the presence of other people is a real draw. It brings people into parks and makes them enjoy the parks more. The last result I want to show you is a little bit complicated, but it's a very important result. This comes from England, where a lot of social research stratifies the population based on social class, from poor to working class to professional to wealthy. So this study does that, and it also stratifies people by how green their neighborhoods are. This is the first set of results, going from less green neighborhoods to more green neighborhoods as we move left to right on the graph. What you see in this relatively wealthy stratum of English people is that the mortality rate drops slightly as people live in greener and greener neighborhoods. Then we add in the middle class people, and you can see that their mortality is higher than that of the wealthy people, but also we see the pattern that the mortality drops as we move across the graph from less green to more green neighborhoods. Here are the poor people, the highest mortality of any social class. We also see the pattern that as they move toward greener neighborhoods, the mortality drops. And now look at this. The disparity between the wealthiest and the poorest people is quite wide in the less green neighborhoods, but that disparity narrows in greener neighborhoods. So the access to green space in this case turns out to be a strategy for reducing the harmful effects of poverty. Well, are we ready to write prescriptions and declare that people need parks and green space as part of a healthy life? Around the country and around the world, a lot of people have drawn this conclusion already. In the healthcare sector, hospitals and rehab centers have had healing gardens for many, many centuries. And as you see in these pictures, some of the best hospitals in our country still have healing gardens in them. This book, Last Child in the Woods, made a broader case. It made the case that children these days are deprived of nature contact compared to a few generations back, and that is a real deficit. Children need that contact with nature to be healthy. The very same author, Rich Louv, made the same argument in a later book with regard to adults. So this goes for all of us. And this book has led to an entire movement, sometimes called the Leave No Child Inside movement. Major environmental groups, the Children in Nature Network, non-governmental organizations around the country have been actively promoting the idea that people need to connect with nature for better health and well-being. There's even legislation, often called No Child Left Inside legislation, that would promote the contact of children and adults with natural settings, including parks. In the parks world, there is a huge movement now in many federal, state, and local park systems around the world to begin to reconnect people with parks and to brand the parks as healthy places to be. Parks as a public health strategy. We're even seeing physicians prescribing a visit to the park as a good intervention for an individual patient who needs it. What does it mean for us here in Seattle or for anybody who works in a park? It means that we need to do better research, because although we have a lot of evidence, as I've showed you, there's still a lot we don't know and we need to figure it out. What arrangements of pathways, what kinds of tree canopy are most effective at getting people to be healthier? We need to select our parks and green spaces strategically so that they are where the people are and so that people can easily use them. We have to consider not just the presence of the park, but what we do with it, not just the hardware, but the software. Partnerships are very important. Parks departments can easily partner with the Pediatrics Association, or with faith communities, or with outdoor clubs, or scouts, or many other organizations to achieve shared goals. We need to demand that parks and green spaces are accountable. When it comes to our schools, for example, we demand that the schools perform. We don't typically demand that our parks perform and measure the improvements in health that they bring about, but why not do that? Why not hold our parks accountable? And finally, we need to communicate all of this. The more we represent to park users, to the public, and to policymakers that parks are a public health strategy, the more people will understand and be able to enjoy the full benefits of parks. As I said at the beginning, our nation faces a lot of health challenges. But the good news is that access to parks and green space is a very important strategy in addressing those health challenges and giving people better lives. If we work together across different organizations and disciplines and perspectives to put that into action, we can get more people into parks and green space, get more people enjoying the benefits of parks and green space, and improve the health and well-being of our society, including addressing profound inequities on a very large scale. That's a fantastic opportunity.